In this video, I want to show you how to add contrast and color to a rather pale photograph. This is a nice case of clear cell acanthoma which Antonina Kalmykova from CSD Health Care in Kiev shared with me, and it's a perfect example of a spot diagnosis. Now, I often find when dealing with in Photoshop, it's quite useful just to enlarge the image. It gives you a better idea of what you're dealing with. So when we look at the image, one can notice several things. Firstly, it's a rather pale section from one side to the other. It lacks life, and in addition, the color differentiation is not terribly good. Everything looks a rather blue-gray color. So we'll start working on it, and as I showed you in the last video, the first thing you always have to do is work on the contrast. So if I click on Image to Adjustments and go down to Levels, and then take the right hand dropper, place the dropper just above the tissue, click on it, and there's not a lot happening. So it looks as if we're not going to achieve much with levels. So the next option is to use the eraser tool. And as before, one starts with a fairly small icon so that one doesn't brush too much off at the one time, and then we follow the surface of the skin specimen like this, remembering to stop every so often so that you don't have a problem if you make a mistake, and we'll work our way along. I'm going to do this fairly quickly because I'm used to doing it, and hopefully I'll not make a mistake as I go along. One always has problems with pale sections, and they're sometimes very difficult to make nice, particularly, I'm going to the bottom now, particularly if the lighting is not perfect. One of the problems with Photoshop is when one's looking at a section where the lighting's not in the center, very often what you do in Photoshop just makes the problem worse. You'll notice I'm scrubbing off bits and bobs at the bottom, and that's because it doesn't really matter, so long as we can leave some of the green behind to show that the section's been inked. And that's something that I'd recommend to you all. It takes a little bit of extra time, but it's always very useful to ink the bottom and the sides of a specimen so that if it turns out to be something troublesome, you can tell whether the lesion has been fully excised or not. Now that's the edges of the lesion, and now we can move along a bit more quickly. I'm just going to follow this all the way along, and you see, as you can see, it's fairly easy to do. You just scrub along, overlapping the layer that you did earlier, and hey presto, you're beginning to see a nicely cleaned up specimen. And then when I've got this one done, I'll use a great big one, a great big brush. We'll bring it on to about there, and you can see how you can actually clean a lot of it in one go. There. That's already looking nice, just by virtue of not having any dirt or any extraneous tissue. Now, the next thing we can do is when we look at it, the focus is good, but it could be better. So before I forget, I'll make that eraser much smaller just in case I have an accident. And so it would be good to use the sharpening tool. And as before, I think it's best to sharpen edges first to see if that's sufficient. And that looks pretty good, but what I'll do is I'll just undo that, go back to filter, and this time go to sharpen and see if that's okay. I think that's better. One of the problems with the sharpening tool is that if an image is of low resolution, it's very easy to pixelate it with the sharpening tool. So you have to be careful. But just remember, anything you do, you can undo merely by going to Edit, and you'll see the undo sharpen should I want to. Now, so we've got the background clean and we've got the image in better focus. So let's see what we can do with the contrast. Now, the easiest thing, as I showed you yesterday or in a previous video, is try auto contrast and see whether that does anything. And it has helped a bit. It certainly brought out the contrast. Now, what we can do, if we want to see if any more contrast is good, we can go to shadows and highlights. So we go to image, go to adjustments, and come down to shadows and highlights. And then go across, shadows is the top, highlights is the middle, and go to amount and just increase it slightly. And I think that little bit of increase has done it the world of good. Now, the only thing that's left is to, well, there's several things actually we need to notice. One of the things when you start playing around with shadows and with contrast, you'll find that bits of dirt that weren't obvious when you started suddenly become apparent. So after you've done that, you sometimes have to go back, as I'm doing, with the eraser tool to get rid of the bits of dirt that have suddenly appeared. And you have to keep your eye skin for that, because it can always be a problem. But anyway, that's it back again. Oh, that's it. There's another bit there, and a bit up there. So now it's now looking. It's got good contrast. It's sharply focused. It stands out a lot. The only thing I just wonder is whether we should mess around with the color a little bit. And there are two ways of doing it. And what I'm going to try this time is I'm going to try using hue and saturation. So if you go to image, go to adjustments, and come down to hue and saturation. And you can always move these little boxes to the side so they're not lying on top of the tissue. And if we increase saturation slightly, let's see what happens. And I think that's absolutely gorgeous. I'm inclined to leave well alone now. And I'm going to, rather than save it, I'm going to save as, so that I can show you the two images before and after, side by side. So that's now saved as. So we'll do that. Now what I'm going to do is come out of Photoshop and go back to my desktop, and I've got to find where this is now. The trouble is I put this pretty histology on the desktop and now I can't see anything, so that'll teach me. Oh, it's Untitled 3. So if we look at the original, that's the original, and then we'll put up the one after Photoshop. So now you can compare the two and see what the difference is. And I think really that's just amazingly improved. And not very difficult, only a few tools were used. And with a bit of practice, I think you'll be able to do that just as well as I can do it. So I hope that's of some use to you. Thank you very much.